Hello everybody and welcome back. Today we're going to continue about the ECG and the leads of the ECG. Now we're going to talk about the hexaaxial reference system. The hexaaxial reference system is the overload lead axis of the 6 frontal plane leads which produce the hexaaxial reference system. The 6 lead axes divide the frontal plane into 12 segments, each subtending 30 degrees. Now we're going to talk about the unipolar precordial leads. Usually there are 6 standard chest leads which are recorded by V1, which is put on the 4th intercostal space to the right of the sternum, V2, which is the 4th intercostal space to the left of the sternum, V4, which is on the 5th intercostal space at the mid-clavicular line, V3, which is half between V2 and V4, V6, which is on the 5th intercostal space at the mid-axillary line, and V5, which is halfway between V4 and V6. For the precordial chest leads, they lie in the transverse plane perpendicular to the plane of the frontal leads. The heart surfaces are close to the chest wall. Each chest lead records mainly the electrical potential of the cardiac musculature immediately beneath the electrode. Relatively minute abnormalities in the ventricles, particularly in the anterior ventricular wall, can cause marked changes in the electrocardiograms recorded from the chest leads. For the precordial leads and the Wilson central terminal, an exploring electrode is placed on each precordial site and connected to the positive input of the recording system. The reference input is a compound electrode, which is the Wilson central terminal, which is the output of the limb electrodes. It is combined through 5000 watt resistances, and each precordial lead registers the potential at the precordial site with reference to the average potential on the 3 limbs. The potential recorded by the reference input remains relatively constant during the cardiac cycle. The output of the precordial lead is determined by the changes in the potential at the precordial site. Now for the ECG leads, an overview of the ECG leads. Each lead is an axis in one of the planes, so either frontal, transverse or sagittal planes, onto which the heart projects its electrical activity. Each lead looks at the heart from a unique angle and plane, and has its unique point of view. The recording from a single lead shows how the lead views the time-dependent changes in voltage of the heart. For the views of the heart, some leads get a good view of the anterior portion of the heart, like leads 1, V1 to V4. So V1, V2, V3 and V4 are leads that have a good view on the anterior portion of the heart. For the lateral portion of the heart, leads 1, AVL, V5 and V6 are having a good view of the lateral portion. So lead 1, AVL, V5 and V6. For the inferior portion of the heart, leads 2, lead 3 and AVF have an inferior point of view of the heart. So this was everything for today. Thank you very much and hope to see you soon again in the next video.